For the past few days, a group of highly trained medical professionals have been making their voices heard outside the Eastern Cape Premier's office. Unemployed doctors and dentists are demanding to be hired, citing a desperate shortage of healthcare workers across the province. Last year, the South African Medical Association and other unions protested against the unemployment of doctors. How big is this issue of unemployed doctors, not only in the Eastern Cape, but in South Africa?
So I just wanted to find out from you guys, South Africans, and what are you telling your children to study now, especially with this issue of having a lot of unemployed graduates? And not only that, but especially when it comes to certain qualifications. I'm using this example of doctors, those who studied medicine and things related to that. You would think those skills will be in demand, like those people will be more employable, so to speak. But it turns out that there is a challenge in that regard. I want us to watch this clip by Dr. Aaron Motsoaledi explaining all these things.
For the past few days, a group of highly trained medical professionals have been making their voices heard outside the Eastern Cape Premier's office. Unemployed doctors and dentists are demanding to be hired, citing a desperate shortage of healthcare workers across the province. Last year, the South African Medical Association and other unions protested against the unemployment of doctors. How big is this issue of unemployed doctors, not only in the Eastern Cape, but in South Africa? Let's now have that conversation with the Minister of Health, Dr. Aaron Motsoaledi. Minister, very good morning to you. Thank you so much for making time for us. What's your reflection around what's happening here with the unemployed doctors?
Well, Aldrin, let's talk about unemployment generally. It is not nice, and I don't think anybody in the country, inside or outside government, enjoys the issue of people not being employed. You are aware the concept of unemployed graduates started long ago. It's not only doctors. Yes, there is a shortage of doctors in 90% of the world. We know that very well. But to hire them also, you need resources. Now, in our country, I'm sure you are aware, even in September, the Minister of Finance mentioned it. We, even in February, we have got very serious austerity measures, very crippling budget cuts that affect not only our capacity to hire doctors, but to perform quite a large number of functions. So yes, we do agree with the grievances of doctors, but in the final analysis, you cannot give a job for which you don't have the means to pay such people, and that's exactly the situation in which we are.
Yeah, speaking about what Treasury said last year, there was a promise that was made by your successor, Dr. Joe Phaahla, while he was still Minister of Health. This is what he said: our national team is working with the National Treasury to thresh out the details and working with provincial health departments to speed up the process so that by April the 1st, all those who will not be already in post can start, meaning that money will be made available through Treasury. And he says that I'm confident that with this certainty, provinces will be able to start giving appointment letters even before April the 1st, 2024. So what happened to that commitment?
Well, we are discussing with Treasury almost every month about our needs in health because of austerity measures. But as far as I know, I don't know under what conditions Dr. Phaahla was making that statement. As far as I know, at that time, because I was also in cabinet still, the Treasury was discussing about the issue of internship. Because Aldrin, please give me some little bit of time to explain this, because I've had all lots of statements. Yes, in medicine, you study for 6 years. When you complete, you can't do anything. You can't work. You can't go into private practice. You can't open your practice. You can't do anything unless you do internship, which is for 2 years. It is statutory, means whether the government likes it or not, the Treasury will have to stop something somewhere to hire an intern because it's statutory. And now that's what I remember at that time. There were more than 800 doctors or interns which were not placed, and they were discussing with Treasury to place them. After you finish internship, you go and do community service, which is also statutory. You are forced by law. And so the state is forced to hire you, whether it likes it or not. After that, you are a free person. You are a fully-fledged doctor. You can go anywhere. If the state...
So there you have it. Minister Motsoaledi explaining this situation of doctors. And I think it's disheartening if you think about it that parents they are encouraged to encourage their children to go to school to study. And I think there used to be a time where being a doctor was such a prestigious thing. But today it sounds like being a doctor or pursuing the career in being a doctor, it's almost like any other career for that matter. And I was wondering that the matric results are coming out now, early 2025, and some of the children are going to be going through to medical schools to study. And our ratio of one doctor per X number of patients is too high because we do not have enough doctors. But now the question is, do you go and tell your children to go and study to be doctors? Or not only doctors, but any other career for that matter. Like I read somewhere where they were talking about almost like an oversupply of lawyers, so to speak. And does that worry you as well? Shouldn't we be, as a country, giving information and helping or teaching our children that there is other careers that they could pursue, so that at least as soon as they graduate, as soon as they get qualified, they are able to get into the employment market as quickly as possible? Now, you can imagine if you, as a doctor, as a graduate, you study for 6 years, you have to wait for the government to have a budget for you to do that internship for 2 years. And if it doesn't happen immediately, that means you wait a little bit. And there's nothing you can do. You cannot practice medicine. And after that, you still have to do community service. So that's like 3 years there. If that 3 years doesn't happen immediately after you finish your 6 years of studying, 9 years. So somebody could end up like 10th year, 11th year, 12th year without them having practiced what they have studied for. And I think it's a good conversation to have as South Africans, that our country is not in a good state, so to speak. The economy, the growth of the economy, joblessness, and things like that. And maybe we need to be agile. We need to move with the times, so to speak. Because now, if prestigious careers like being a doctor is struggling for people to be employed, you can imagine what happens. Like, nurses are not going to be prioritized. If you send your child to study to be a social worker, and government is not prioritizing social workers and all that. If you send your child to go and study things like humanities, like psychology and things like that, the government is not prioritizing those type of a career, so to speak, in terms of funding them. We need more police officers. We need more traffic officers. We need more teachers. We need more prison warders and things like that. There are a lot more things that are demanding where the budget is not going to be enough in terms of absorbing everyone. So I think it's a good question. I want to know what you guys think about the type of careers that we need to be channeling our children towards, especially in this time of desperate needs that we have in South Africa, whereby you being a doctor is not going to be good enough. Previously, we used to think like if you study and become a doctor, you know what I mean, you are going to be well off, so to speak. And it seems like those years are behind us. If what Minister Motsoaledi is talking about now, where people have to go and protest, they want to be absorbed, they want to be hired. You can imagine now, even if after you finish your community service, your internship and all of that, you still want to be hired. You might not have the money to go into private practice, and that's like a very scary for me anyway. So what do you guys think? I'd like to hear your thoughts. If there's people who got experiences in this type of things, please be so kind and share these things with us so that we can know. The more information we have, the more information we can disseminate to many different people, especially the young people. Like, hey, don't waste your time studying this thing. That's not going to get you a job. You might have a degree, but you're sitting at home. That's not really helping anybody, So please, man, I want to hear your comments. What you guys think, and please be so kind and share this video with as many people as possible. And yeah, if you haven't subscribed, please do so. Like the video as well. And yeah, if you have subscribed, thanks again for your guys' love and support. We'll see you on the next video. Bye-bye.